Do children need dental cleaning? I would say yes. Yeah, the short answer is yes. But how often is so different from adults? We would usually, depending on how old your child is, for example, if they are 3, no, there is no cleaning needed. We have a look, we make sure that your oral hygiene is good, their oral hygiene is good, you're teaching them correctly, you're doing it with them, stuff like that. Of course, if there's a cavity, either we monitor or have to fill it. But when they get older, especially when they're teenagers, they're now going to start eating worse. And they're going to be more slack in cleaning their teeth because they're teenagers usually. So in these cases, they do need dental cleaning. But how extensive the clean, how often, all of this depends on what's going on in the mouth. For example, for some, I only need to polish with a brush and a bit of prophy paste and it gets rid of all the plaque. For some, we need to actually do a dental scaling and cleaning because they have a lot of buildup and calculus. We cannot compare one with the other, but what's obvious is that your child needs to see a dentist also every 6 months. Not only to take care of their oral health, but also to establish this habit of going to the dentist regularly. Dentist is not a scary place, and they grow up with better teeth. What is the difference between regular dental cleaning and deep cleaning? Not everyone needs a deep clean. If you have healthy gums, you would just need a scaling and cleaning every now and then to make sure you maintain the healthy gums. If due to any reason you have gum disease or gum and bone disease, which is called periodontitis, you want to see a periodontist who is a gum specialist. In that case, you might be recommended to do a deep clean because there is so much buildup attached to the root surface of your teeth. It's not only above the gum anymore. There are like barnacles attached to basically your roots that we have to clean the roots. It's called root planning. Once the surface of the roots is smooth and clean, there is much less bacteria there. The gum can reattach and hopefully heal itself if it's not too late. Can you get dental cleaning if you are pregnant? Pregnancy can cause inflammation in the body, especially in your gums. You probably will get more bleeding gums. There is something called a pregnancy tumor, which is not at all dangerous and it'll go away. But all of these changes will happen because you're pregnant. And yes, a dental cleaning is such a good idea because it'll clean your teeth, reduce the inflammation. Another thing that I would recommend is use warm salt water as a mouthwash because again, it can disinfect and reduce the amount of inflammation. Once the baby is born, the inflammation starts reducing, you should see an improvement in your gum health and there should be no more bleeding gums. If there is, talk to your dental professional. Can you undergo dental cleaning if you have sensitive teeth? This is a common problem. People with a lot of sensitivity don't want to get a dental clean done because of the water and the vibration makes them feel uncomfortable and more sensitive. You still need a dental clean because just because your teeth are sensitive, it doesn't mean that there are no buildup or calculus or tartar in between them. If anything, you need it more than other people because if you get more and more gum recession, due to the fact that you're not doing a dental clean, you will have more sensitivity. Why? Gum, imagine, gum is right here, right? That's the tooth, that's the gum. The gum keeps going down, down, down because the buildup is pushing it down. This area gets naked and cold and sensitive. So you don't want to skip on your cleaning. Now, how can you help it? First of all, talk to your dental professional. There are a special toothpaste they can prescribe for you to use couple of weeks before you come to desensitize your teeth. They can, worst case scenario, numb you, use numbing gels, use warm water if they can. Sometimes we can, change the water if it's not connected to the tap, or they can go slowly. Even sometimes we can only use manual cleaning, which is not possible as much because we usually need to use a combination of the machine and the manual. But as I explained, skipping your dental cleaning is not an option. Worst case scenario, ask for a numbing injection, be fully numb, but get the teeth clean because if you leave it be, it's gonna worsen the situation with your gums and the sensitivity.